Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Welcome back to another episode of Dental Fuel. Dental Fuel is brought to you by 90 Day Jumpstart, a program to help you increase production and break free from financial stress. You met Chad, you met JB, and today you're gonna meet Jeff Horowitz to close out the Dentist in the Know. Jeff Horowitz is based in the Myrtle Beach area of South Carolina, and we talk about his passion for orthodontics and airway management. Jeff transitioned from general to specialized dentistry, and he reveals his experiences and the critical mistakes that he has learned from. In our first conversation, we talk about a clinical mistake that he's made and what he learned from it. Let's check it out. Jeff Horowitz, welcome to Dental Fuel. How are you doing today?
I am so great, and I am so excited to see your face today.
Oh, I'm just as excited, and I'm really excited because I had the opportunity to speak with JB and Chad on Dental Fuel, and we are rounding out the Dings Trio with you on our podcast today.
Well, you always save the best for last, isn't that right?
That's right. Yeah, that's right. They may be a little bit jealous after listening to our conversation today.
I know. I hope I don't disappoint.
Oh, you won't. You won't. I think we're gonna have a lot of fun with our convo today. But Jeff, please tell me and our listeners, where are you coming to us from today?
So I'm in the Myrtle Beach area of South Carolina, live in Conway, which is about 14 miles to the northwest of Myrtle Beach. And I have two practices, one in Myrtle Beach proper and one in Murrells Inlet, South Carolina.
Very cool. And are you born and raised from South Carolina?
They don't grow Horowitz in South Carolina. Horowitz are maybe imported. Yeah, no, we're imported. No, I'm originally from New Jersey and ended up in dental school down here in Charleston and tried to go back for a year, and that wasn't gonna happen. So, yep, I'm almost a local here. And when I go home, they say I sound like a redneck. And down here, they say I sound like a Yankee. So I have no home.
Yeah, you're a boy from the South now.
Yeah, I probably am more Southern than I am New Jersey anymore, except when I drive.
Good. Yeah, I hear you. Well, Jeff, here at Dental Fuel, we are dedicated to learning from each other's mistakes and growing after we learn from those mistakes. And so that way, hopefully, we won't make those mistakes along the way. And I'm really excited to just tell your story. But before we dive into the different mistakes that we have to feature on our conversation,
I could talk all day on mistakes.
Oh, I'm right there with you. I make a lot of mistakes every day. I would love if you would tell us a little bit more about yourself. Who is Jeff?
Oh, gosh. How much time do you have?
I got all day.
No, it's interesting. Just a guy from New Jersey that probably outkicked his coverage in a lot of facets of life. Knew I wanted to be a dentist and went to the University of Pittsburgh, hoping I would get into the dental school there as well. Got accepted early admission to Fairleigh Dickinson back in New Jersey. Ended up transferring to Charleston, South Carolina, and pretty much never looked back. Fell in love with South Carolina. Did have a job offer, went back to New Jersey for a year, did a residency, thought I was going to take that job. And 1 year in New Jersey, I'm like, nope, not doing this. I am planting my roots in South Carolina. So opened a practice in a small town called Conway, just west of the Myrtle Beach area, kind of part of that Myrtle Beach proper area. And, it started out basically as a practice with a lot of children, started from scratch, one pediatric dentist, one orthodontist in the entire county. And I figured if I'm going to build a practice, I might as well learn how to take care of kids and learn how to do ortho. Well, didn't realize that was going to reshape my entire career because during that time, learning orthodontics, got into functional appliances, learned a lot about airway and the joint, and we started growing children at an early age. And I never looked at my dentistry the same way ever again. Everything in dentistry was about this larger cause of having people grow into healthy adults. And so my practice ended up maturing. We grew a lot of kids. We helped a lot of airways, even before it was kind of a vogue thing to do. And then, like a lot of practices in the late 90s and early 2000s, this cosmetic revolution came about. And so got really into the cosmetics because all those kids were now adults and starting families, and they're all wanting this cosmetic dentistry. And kind of earned my chops a little bit at the Koi Center and a lot of other aesthetic continuums as well. But in all of that, I always had this passion to kind of go back and focus on the functional side of dentistry. I love cosmetics, don't get me wrong, and I love, giving people new confidence, but I always would go back to, is this going to function and is this going to last? And so that's always kind of ruled my world. And so after finishing and becoming a mentor out at Kois, and I said I really need to revisit the whole TMJ thing again and really get my skills down pat where I'm very, very comfortable with the joint. So I went and did the Piper Continuum and got really close with Dr. Piper and Jim McKee and that whole study group. And really, that's really where I earned my chops in TMJ, even though I had learned from so many other great mentors. But, everything for me and what I became passionate about was that, as I was bringing associates on, these people were really good at the dentistry. And so my patients didn't really need me to perform the general dentistry anymore because I had people who were just as good, if not better than I was, at performing those, those procedures that were needed. But where I was needed was, what's going wrong with this case, or how should we be diagnosing this case to realize, where are we getting in trouble when we get into these large cases? Like, did they have an airway problem? Did they have a foundationally based problem? And that became my passion. I started 2 satellites, which are just sleep TMJ and orthodontics. And that's where my primary focus is, though. I still own one of my practices. But, really, where my passion is on the functional side of dentistry.
I love that, Jeff, and I love listening to you speak and your passion behind, these areas and these topics. But speaking on, function and knowing if things are going to last, I'm curious if that has anything to do with any clinical mistakes that you have made in your past.
Yeah. I mean, if we could probably do a 1-day conversation just on mistakes made. So I know when we had talked earlier, you asked me to come up with one big mistake that really stands out in my mind. And it's one that I always share in my lectures. And it was missing a functional problem prior to getting into treatment. Now, in this case, it happened to be an orthodontic patient, but it just as easily could have been somebody coming to me for another cosmetic procedure, and missing this functional problem really should have gotten me sued. And so this is what I preach when I lecture, which is, don't ignore function, because that's what's going to take your cases down. It's not your dentistry, especially if you're well educated and, you care and you're using good materials and good labs and performing, in a way, above the level that many other dentists do, but yet cases will fail if we misfunction. So this young lady comes to me with her mom. She's about 10 years old. I was doing a lot of ortho at the time. And she, class 2, open bite. And it was probably one of the worst times in my career looking back at it. At the time, I thought it was one of the best times in my career because I had become a little bit cocky. And cocky and dentistry just don't go together in any way, right? The second you think you're good, something will bring you down. Like something will take you down a notch. And so this young lady was that case. And I purposely show her in every lecture I do to say, look, This happened to me with all the functional knowledge that I have. So here are some of the things you need to look for. Well, so going back, class 2, open bite, obvious signs of a mouth breather. And because I was in this little cocky phase and how good I was with orthodontic mechanics and how good I felt like I was, I said, oh, no problem. Class 2, open bite. I got this. I know all the tips and tricks, and I got this. I can do it. And, went through all my orthodontic protocols, took our 8 pictures, took our Ceph, our panoramic at the time. This was before I was even doing cone beam. So took all of that data, got that all in, and started the case. Well, what didn't I do? I didn't review all those records that I had taken. It was an exercise in doing what I was supposed to do, but not really using the data to make good, sound clinical decisions. And several things that I missed that had I seen it right away, I would have known this was a TMJ case that was really going to blow up in my face. She actually had a facial asymmetry. Her posterior occlusion was only on one side. And so she had really an open bite 3/4 of the way around. The only place she was occluding was like on the posterior right. And that's just a dead red flag. Chin asymmetry, occlusion in one quadrant of the mouth. Guess what? I mean, this is a foundational problem. And if you don't address that while the child is growing, this bite will never be stable no matter what you do. Well, 4 or 5 years of orthodontics later and still fighting the open bite, and things are getting worse as I'm going along. And all I could think is, I'm going to get sued over this. I'm going to get sued over this. And, it's a little easier to catch those things now with cone beam. Just I would have caught the asymmetry right away. Even when it first flashed on the screen, I would have seen the difference in ramus heights, but she had fallen off a horse the year before she came to me and had an injury to the growth plate, and the condyle on the right side was almost 10 millimeters shorter, or the ramus height was almost 10 millimeters shorter on the right than it was on the left. And so she was never going to grow properly. The occlusion was never going to settle. In fact, her joint situation got worse and worse, and she was truly a joint surgery case, which is what we had to do at the end. But it still haunts me to this day. What
was the result? She was fine after the
So I mean,
surgery.
So 5 years of orthodontics. My finish would get me laughed out of most orthodontic meetings. Although for what it was, now looking back at it, I'm like, dang, I can't believe I even got that. As bad as the joint was, but it was never going to be stable. So the fact that I had gotten her arches leveled, aligned, and gotten her to a pretty close to ideal occlusal relationship allowed it for it to become a surgical case without a lot of other pre-orthodontic treatment needed before that.
Wow. Thank you for sharing that case. That's a wild case.
Yeah.
I'm sure you learned a ton from that.
Always, and that's why I put it in every lecture, even if I'm not specifically talking about the joint. It's just a reminder of how important the other things that we're not always looking at are airway, the joint, everything about function, dynamic occlusion, not just how the teeth fit together, when they're in maximum intercuspation.
Thanks for tuning into this first episode with Jeff Horowitz. Be sure to check out Jeff and our friends at Dentists in the Know every Wednesday evening, where they have a new guest and interview them live on YouTube. With Jeff doesn't stop here. Be sure to tune in next week, where we talk about a financial mistake that Jeff has made. If you're looking to grow your practice and need some help along the way, be sure to check out 90 Day Jumpstart. You can start for free by contacting Dr. David Rice. Check out the link to his Calendly in the show notes.